Hi, good afternoon, everyone. A little introduction about myself. This is Dr. Shamaila here, and I hope you all are doing well. Um, Now, as I see, many students are coming in now. I just want a brief introduction of you all, just a brief understanding. Are you all in the final year and the third year? Which year of homeopathic study are you all in? In the chat, if you can reply quickly. So I have an understanding that what you all are, aware of which remedies or something like that. If you can just reply me quickly in the chat, it will help me to understand where you all are from basically. And I'll be waiting for another couple of minutes to see if other students are joining in. Okay, so we wait. In the meanwhile, you can reply. Mhm. Okay, so I see somebody here about to enter second year. Wow, great. Many are from the final year. Okay, so okay, all basically many from the final year, just one or two from the second year and third year. Okay. So the students who are in third year, I think Miasms is for you all in the final year, right? If I'm not wrong, the classification of disease and miasm is in the final year or it is in the third year? Because to be frank, when we were students, we had organon from right from the first year. And in the final year, we didn't have organon. We had only repertory when I was a student. And I think with you all, the recent changes, you people don't study organon in the first year and you study it from the second year. So hence I'm asking you that understanding of disease, classification of disease, is it a topic of third year, final year, which year? Can you please help me in the chat? Organon is from second year, yes, but classification of disease is from third year, right? Where we study acute diseases, chronic diseases, and okay, you have that topic in second year also. Okay. Okay, fine. Then those children who are, from the second year, they will also benefit from this. So I think we have waited enough and I start with the session for today. Understanding of miasms. Okay. Just a moment. Okay, fine. So let us begin. The topic is understanding miasms. So let us first see what is the dictionary meaning of the word miasm. Now, the dictionary describes this word miasm as unhealthy vapors rising from the ground or other sources. So basically, what are these? These are unhealthy vapors which are rising from the ground or other sources. These vapors were formerly believed to cause diseases. Now, this is the dictionary meaning. These are vapors that rise from the ground, and these vapors are believed to cause diseases. So, hence, because they are believed to cause diseases, Dr. Hahnemann, in order to explain what is the concept of chronic diseases and describe the origin of diseases, he used this word miasm. Okay. Now, as we all know, organon of medicine is the Bible of homeopathy. So everything that we study in reference to the organon of medicine. So anybody has any idea which aphorism discusses the theory of chronic miasms and which aphorism discusses acute and chronic miasm? You can reply in the chat. Anybody has any idea? No idea? No messages so far? Okay. I hope it is clear, like my audio is, my sound is clear, the audio is clear. I hope it's not, any problem with that. If you can, any of you can reply me, it will be helpful so that I understand that things are fine. Technically, the things are going fine. Okay. Okay. Thank you so much. Okay. So I'll start. Basically, Hanuman introduces his theory of chronic miasm in from aphorism number 72 till aphorism number 82. Okay. Here, Dr. Hanuman introduces the theory of chronic miasms by first perceiving the differences between acute and chronic diseases. Okay. So how is he describing this miasm? First, he is classifying it into acute diseases and second into chronic diseases. Okay. Now let us see. Origin of miasm. How did he come up to this theory of miasm? Okay. Dr. Hahnemann, as you all know, is the founder of homeopathy. He sought an explanation for frequent relapses that he observed in certain patients with chronic complaints. Okay. So, as we know, in his practice initially, he would see that there were few cases which were responding very quickly to medicines, and that symptom would disappear. They would never come back. But there were certain patients with chronic complaints where there would be frequent relapses that he observed. And he observed them in great detail and classified them. Like whatever patient would come up with a chronic complaint, he would study them in great detail and classify them in 3 broad groups with a definite attribute and a definite predisposition. Okay, means he studied them, he studied the symptoms, he studies those patients, and he classified them into 3 groups. Each group had its own attribute, each group had its own predisposition. And what he found was there was a close association between these groups, like the 3 groups that he had made, and the diseases of itch, syphilis, and gonorrhea, which were rampant in those days. Okay. So first, how did Dr. Hahnemann come to the theory of miasms? With his own patients. Which patients? The patients which were not improving with their complaints. They had this chronic relapse. These complaints in these patients would recur frequently. They would get better for a while, and then again the complaints would recur back. So he observed them and classified them into 3 groups. When he classified them into 3 groups, he found out that there was a close association between these 3 groups and the diseases that were prevalent in those days. That is the itch, the syphilis, and the gonorrhea. Okay. This association led him to postulate a relationship between these 3 groups of the symptoms of the patients. Okay. These 3 groups of the diseases, and the 3 diseases, that is the itch, the syphilis, and the gonorrhea. I hope it is clear so far. Any doubt? If you have any doubt, please let me know so far. Okay, going good. So now Dr. Hahnemann studied the homeopathic drugs and classified them into three like groups. Now, first, what he studied was his own patients, his own cases. Then he found out that there is a correlation in these three groups of patients with three prevalent diseases of that time. That is the itch, the psychosis, and the itch, the gonorrhea, and the syphilis. Okay, and now he studied the homeopathic drugs and he classified them into three like groups with the similar attributes that enable the division of the diseases. Okay, understood? Like in one group of patient, he found a particular set of symptoms, and in another group of patient, he found a particular set of symptoms, and then he found that this A group of patient has very similar symptoms to that of the disease that is itch, that is on that of that time. He found out that group B has symptoms very similar to that of gonorrhea, and he saw that there is a group C which has similar symptoms to that of syphilis. And now he studied our homeopathic remedies and he found out that few remedies like XYZ, they belong to group A. They show very similar symptoms to group A. Then he found out that XYZ remedies, they have similar symptoms to group B and similarly to the group 3. That is how he basically came up to the theory of three like groups. Okay. Now, the classification is the most important part. The classification is based on his exhaustive study of diseases. Dr. Hahnemann studied his patients and their relation to drugs in materia medica, and hence he classified disease to be acute. Now, acute diseases, he has mentioned it in aphorism number 72. It is a rapid, morbid process of abnormal, deranged vital force, which has a tendency to finish the course more or less. There's a mistake here. It's more or less quickly. Okay, it's a mistake in the slide. It should be more or less quickly. Okay, so what is acute diseases? Acute diseases are always precipitated by an unfavorable factor in the external environment and which is correctable. Okay. Now, aphorism definition is the rapid morbid process of abnormal deranged vital force, which has a tendency to finish the course more or less quickly. But the applicable definition or the applicable understanding of acute diseases, it is always precipitated by an unfavorable factor in the external environment, which is correctable. Okay. Now, the chronic diseases. The chronic diseases also, the definition is mentioned in aphorism number 72. It's a long definition which sometimes is asked in the exam, but better that you have a brief understanding of chronic diseases, where some patients who come up with an acute disease, they do not improve under treatment beyond a particular point, or they develop symptoms, they like an acute symptoms which tend to relapse again and again. Okay, patients, they report primarily for one complaint which cannot be termed acute. Okay, as we all know, somebody, we know so far, like he's having this joint pain complaint since 5 years. आते जाती रहती है, कभी होती है, कभी नहीं होती है. Some person will have a chronic complaint of headache, but there is one episode, one first initial acute episode, okay, of a headache, which would have started it. Okay, which did not improve under treatment, or it did not improve beyond a particular point. Like it got better for a while, and then again, it came back. Okay. So now acute diseases, we will study what are these. Acute diseases, they have an exciting cause. It is an injurious influence where the person is briefly exposed. Now, simple example could be excess in food. ने खाना ज़्यादा खा लिया, so we sometimes feel we have an wedding or something and we tend to overeat. कुछ ज़्यादा खा लिया, that could be excess in food. It could be lack of food. Since morning you haven't eaten properly, and by the time या शायद सुबह में चाय नहीं ली है, या फिर सुबह में ब्रेकफास्ट नहीं किया है, एंड बाय इवनिंग आपका सर दर्द होने लगता है, या फिर यू स्टार्ट फीलिंग अ बिट वीक, यू स्टार्ट फीलिंग लो. सो दैट कुड बी एन अक्यूट डिजीज. इट कुड बी जो हम पढ़ते हैं या देखते हैं हमारे अतराफ में, एक पानी पूरी खा ली, एक प्लेट पानी पूरी खा ली, एंड देन द नेक्स्ट डे यू लैंड अप विथ बर्निंग in the chest, and you land up with loose motions or something like that. Acute episode which you are briefly exposed to. आप थोड़े से वक्त के लिए उससे expose हुए और उसके बाद ये आपको symptoms आए. It could be an exposure to physical irritation. Suppose you are passing by and there are 2-3 people smoking on the corner of the road, and suddenly you start coughing. So this is an acute exposure and there is an acute reaction to it. Okay. Removal of the factor brings out cure. जैसे हमने ऊपर देखा कि एक्सेस इन फूड हो गया, आज बहुत ओवर ईट कर लिया, तो हम नेक्स्ट डे क्या करते हैं, वी ट्राई टू ईट समथिंग सिंपल. नेक्स्ट डे वी से नहीं, आज मैं कुछ सिंपल खाता हूँ, आई विल मेक दाल राइस और आई विल ईट सिंपल खिचड़ी बिकॉज yesterday और लास्ट 2-3 days आई हैव बीन ईटिंग टू मच. लैक ऑफ फूड, जैसे खाना नहीं खाया उस वजह से हेडेक हो रहा है, या सुबह चाय नहीं पी उस वजह से हो रहा है, एंड यू हैव दैट एंड यू फील बेटर. और एक्सपोजर टू फिजिकल इरिटेशन में, सपोज देयर इज अ रूम वेयर पीपल आर स्मोकिंग और देयर इज अ डस्टी रूम एंड आप वहां से थोड़ा हट जाओ तो यू फील बेटर. ओके. नाउ you will think कि why acute diseases is combined with miasms. Yes, आ रहा है ऐसा कुछ thought कि acute diseases और acute miasm क्यों? कि डॉक्टर हैनमैन ने जब ये स्टडी शुरू की, डिजीजेस की स्टडी शुरू की, when he started to consider what is causing these diseases, okay, he understood कि इनके पीछे कुछ तो फैक्टर है, कुछ तो एक ऐसी चीज है जो इस डिजीज को शुरू करती है. कुछ ऐसा फैक्टर है, कुछ ऐसा वेपर है जो इस डिजीज को शुरू करता है, और ये फैक्टर और ये वेपर को उन्होंने कहा था कि ये मायाज्म है. तो जब तक हम ये अक्यूट डिजीज नहीं समझेंगे, जब तक हम क्रॉनिक डिजीज नहीं समझेंगे, हम ये मायाज्म नहीं समझ सकते. ओके. तो acute miasm have sudden manifestation. Now इस miasm की वजह से जो इस person के अंदर है, this acute miasm is there in every one of us. Okay, जिसकी वजह से हम sudden manifestations दिखाते हैं, suddenly symptoms manifest होते हैं, and there is a strong threat and the person reacts in an instinctive and a reflex manner. सो व्हाट इज द थ्रेट? हमने कुछ पानी पूरी खा ली, हमने कुछ ओवर ईट कर लिया, ये एक हमारी बॉडी के लिए एक स्ट्रॉन्ग थ्रेट था, और जिसका बॉडी ने एक इंस्टिंक्टिव रिफ्लेक्स मैनर में रिएक्शन दिया कि एक इमीडिएट वॉमिट हो गई, या एक इमीडिएट लूज मोशन हो गया, या एक स्मोक्ड फिल रूम में हमको सडनली खांसी शुरू हो गई. ओके. So this is an acute disease, and what led to it is an acute miasm. So far clear? Understanding? Now coming to chronic disease. So far acute disease is clear? Good. Thank you, Afia, for replying. Now chronic diseases. Now as we all know, हम हमारे घर में, हमारे अतराफ में, या हम खुद इस फेज से गुजर चुके हैं. Every one of us might be having something, who knows somebody with a chronic diseases. These are chronic diseases are, or the chronic patients are they had down with some acute disease which did not improve under treatment beyond a particular point. एक दिन 2 दिन उनको रिलीफ मिलता है दवा लेने के बाद, या 1 month 2 month 3 months उनको रिलीफ मिलता है, एंड उसके बाद this condition, this symptom tends to relapse. It tends to come back. Okay. So when Dr. Hahnemann was studying this chronic disease, के एक set of patient है जिनको कुछ acute exposure हुआ, वो लोग ठीक हो गए, कुछ दवाई दे दी उनको, या फिर उसके हिसाब से उनका जो acute triggering factor था उसको हटा दिया गया, they felt better. बट ये जो सेकेंड कैटेगरी थी जो क्रॉनिक डिजीज की थी, जहां वो लोगों को या तो दे डिडंट एक्सपीरियंस कंप्लीट इम्प्रूवमेंट, पार्शियल इम्प्रूवमेंट था, या फिर वो डिजीज जो है कुछ दिनों के बाद रिलैप्स होती थी. आई विल बी जस्ट बैक इन अ मोमेंट. ओके, आई विल जस्ट कम बैक 1 minute. I'm sorry. I'll start again. 1 minute. Huh? Yeah, here we were. So Dr. Hahnemann grouped these patients into 2 categories. Now, which category? The chronic disease patients into 2 categories. One with no history of venereal disease, and one with a history of venereal infection. Okay. In the chronic diseases, there were 2 categories. One with no history of venereal diseases, and the other category was there was history of venereal infection. So I think I'm running out of time in this meeting. I'll stop this meeting and again restart a meeting. Okay, so don't go anywhere. I hope it gets restarted on its own. Just a moment. Huh? I hope you all are with me. Okay, just saying 5 minutes left to the meeting. I'll stop the meeting here and I'll restart a meeting. Okay.